everybody, it's Dr. Chris with Texas Chiro Health, back with our 12 Minutes to Health. Just wanted to take a second, say thank you for joining us each and every week so that we can bring to you the peer-reviewed medical research that applies to your health and your lifestyle and what it takes to be a healthier individual. For me, this is my favorite part of what I do, is getting to help educate people, help educate the community, families, friends, everybody on how to live a healthier lifestyle, and to bring you the actual research, the real research that's out there. I talk to you all the time about how the word research can be misconstrued to mean marketing or used to, I guess, kind of push people in a certain direction when it comes to health for a certain product or whatever it may be. So I do my best to bring you the actual research, the randomized controlled trials, the research reviews that are out there, so that we can give you an unbiased approach to health and what it takes to be healthy. So, I enjoy doing it, and I really appreciate you guys joining in. Just a reminder, we do this every Tuesday night in the clinics at 5:15. We have healthy refreshments and snacks and green smoothies, but most importantly, you get to come into the office, meet with the doctors, grab the research, ask the questions that you want to ask that maybe don't get answered in this 12 minutes, and just be with the doctors to get those answers. So it's a huge benefit, and also we'll come to you. Like I always say, we'll come out into the community, bring you guys a healthy lunch, do one of these talks for you guys, and get you the answers that you need. So either way, happy that you're here for the 12 minutes of health to find out, what it really takes to be a healthier person. So with that being said, let's dig into the research here. Today we're looking at chiropractic care, which is all about movement, which we will talk about, because movement is key to our joints staying healthy, preventing decay, preventing scar tissue, all the stuff that causes pain and dysfunction. So this study was done by Cherkin, who's a PhD, and it's called Innovating to Improve Care for Low Back Pain in the Military. Chiropractic Care Passes Muster. So basically, this is a study where it was a randomized controlled trial. They took two different groups. They put them into a usual medical care group, which typically consists of NSAIDs, or non-steroidal anti-inflammatory drugs, basically over-the-counter Tylenol, aspirin, which is the acetaminophen. It's the standard of care for low back pain inside the medical community. And they had another group that they took, and they did usual medical care plus chiropractic care. They said that they did this to remain pragmatic throughout the study, instead of just taking chiropractic care alone. There are other studies that have very similar, if not even more improved results, that are just chiropractic care versus usual medical care, which you can find more of those talks that I've done on those studies on our website at texaschirohealth.com. So with those two different groups, they had significant statistical differences, okay? So inside of research, there's differences, there's moderate differences, there's significant differences. They're rated, right? So significant differences come down to like a 30% improvement. And the improvement is based off of how they came in and how they leave the study. This study took place over 6 weeks. So the group that was usual medical care plus chiropractic care had a 62.6% increase in function and decrease in pain, compared to the group that was just usual medical care, which was 46.6% decrease in pain and increase in function. So that was at the 6-week mark, okay? They also took this group and they looked at them at 12 weeks. They stopped all care at 6 weeks, but they looked at them at 12 weeks. And the way that they stated it in the study is that the usual medical care plus chiropractic care group had largely maintained the results of 6 weeks at 12 weeks. So largely maintained meant that I think they said there was a 90% of the people were as good or better at the 12-week mark. Even after stopping the adjustments and everything, they stopped all care. 6 weeks later, still had the results that they were looking at, with zero negative side effects from the chiropractic adjustment. So it's not a surprise. I talk about this all the time with patients and everything else, and they talk about it in the study. The reason that this happens is because chiropractors are back pain specialists, and they enjoy treating back pain. And because of that, the patients coming into this actually had a higher expectation that were in the chiropractic care group. So you put those three things together and you're gonna get better results, especially when we create motion, which I'll talk about in just a minute. On the usual medical care side, I know a lot of friends that are physicians and they don't like to deal with back pain because their answer is NSAIDs or opioids, right? That's what they do. And then you can go to an orthopedic and you can get into the injections and the rhizotomies and the nerve blocks and all that stuff, but it all wears off. I had a conversation at dinner last night with a friend of a friend. I didn't even know the person, but I noticed that their neck wasn't moving very well. And I didn't say anything, but it came up that I was a chiropractor. And he says, oh my gosh, I've got terrible neck pain. I've got an injection set up for next week and everything else. He's been through everything he could medically, and they're onto the injection part. And he has zero faith in the injection. And he's on a bunch of steroids right now, which give him motion, which give him more range of motion some days, but not every day. And that's exactly what this study is talking about, is we're not getting motion back into the joints without chiropractic care. And that's absolutely vital, which we'll talk about in just a second. But I want to talk a little bit about why the military was used for this study. It's a really good control group. We know what they're doing for physical fitness. We know where they're sleeping. We know what they're eating. I mean, it's a very, very good group to study. And they took 750 of them from 3 different states. So it's a really large group when you look at this type of study. And they're all younger and they're in good shape. So again, it's a good control group. The fact that they're young leads to more acute back pain than it does chronic pain, right? They just haven't had the pain as long. So that makes for a good control group when we're looking at the acute side of things. And the other thing that they point out in this article is the fact that they're young means most of them aren't on opioids yet. They haven't run down the road of all the different medical treatments for back pain, so they didn't see a lot of people on opioids. So it made, again, a great control group because we knew exactly what they were taking. There was no difference from in the 750 people. Well, this one's on a stronger medication, this one's on a lower medication, whatever it may be. So it made it a very, I guess, exact kind of randomized controlled trial, which make for the best studies and give us the best results. And so they were saying, you know, because this study was done in the manner that it was done, we got great results, and we don't expect that there was any kind of any other factors at play there. So, you know, again, chiropractic care outperforms usual medical care for low back pain in this study here. I get into a lot of them about neck pain and headaches and all the other ones, and you can watch those other videos. But the main theme you're going to find in all these studies and all the reviews of this literature that I do is Hilton's Law. And it's why chiropractic works the way that it works. Hilton's Law is all about your joints. It talks about how a nerve that innervates a joint also innervates anything that crosses that joint. So the muscles, the ligaments, the skin, the tendons, everything in that area is innervated by that same nerve. That means that that area of your brain is concentrated on everything about that joint, and that nerve goes back to it. Okay, so when there's motion in that joint, there's activity in the brain, everything's working well, the muscles are working well, we're in a good spot. When there's not motion in that joint, we get decay, we get degeneration, we get scar tissue, adhesions. A lack of motion in a joint starts to build up scar tissue and degeneration. The problem is, because of that nerve and because of Hilton's Law and what it states, we also get degeneration in that portion of our brain. And those two things over time start to add up to pain, dysfunction, and overall discomfort. When we restore motion to that joint, we bring it all back. We break up those adhesions. We get the joint moving the way it should. We stop the degeneration from progressing any further, and the pain goes away. Motion is absolutely essential to decreasing pain and to overall health. Chiropractic works the way it does because each bone moves relative to the other bone in your spine. So each segment moves, and there's a bunch of different joints in there. When we restore motion to all those joints and we get each segment moving again, which is impossible without the chiropractic adjustment outside of a lucky slip and fall or a twist that breaks something up in there, we get that motion back and the pain goes away. And chiropractors are experts at finding the areas that have decreased motion and restoring it to reduce the adhesions, the scar tissue, the degeneration, and the pain. So Hilton's Law is the key theme in all of these studies that are done on chiropractic care versus physical therapy versus usual medical care, whatever it is. There is no drug or surgery that will restore motion the way a chiropractic adjustment can. There are no physical therapy exercises or modalities that can restore motion the way a chiropractic adjustment can. And that's why you continually see the theme throughout the medical research that chiropractic care is the best, most efficient, most effective, most cost-effective way to go about treating back pain and neck pain and headaches and things of that nature. So it all comes down to Hilton's Law. So I talk about it all the time. If you're in our office, you can grab the card to remind you about Hilton's Law that also you can hand out to people to let them know why chiropractic care works. And we love it when you spread that information. And that's why we do these talks, so we can also spread that information. So again, the research is clear. Chiropractic care for low back pain it's unequivocally the best. Nothing is better in that area than chiropractic care. So if you are suffering with low back pain, you know somebody suffering with low back pain, stop waiting to take care of it. Stop just alleviating the symptoms with Tylenol or nerve blocks or rhizotomies or whatever it may be. Get into the office and let us help you by taking advantage of our special offer, which is just a $39 donation from you guys to our local monthly charity, and that covers your x-rays, the exam, the consultation, and our spinal health assessment, which is the proprietary health software that we use to find the spots that are not moving correctly, assess your lifestyle, see why that happened, give you an overall health score, and point to this exact spot so that we can help you to reduce your pain. We'll give you the health score from 0 to 100. Every so often, every couple of weeks, we'll do another spinal health assessment. We'll see how you're improving from exam to exam, and we'll do whatever it takes to get you guys out of pain. So, we've knocked this all the way down to just that $39 donation so that there's no more excuses. So you guys get in there, take care of yourselves, and give chiropractic care a try for your low back pain. So give us a call, check out our website at texaschirohealth.com, or come in on Tuesdays or set something up for us to come bring you a lunch, and we can do more of these talks and talk to you more about the health information. So thank you guys for joining the 12 Minutes to Health again, and I'll see you next time. Thanks.